Pioneers in weight loss surgery, KularHospital.com, Ludhiana, Punjab.
Hanji, how are you doing?
I am fine, thank you. A lot better than before.
Good. So could you just narrate your story in about 2-3 minutes
Yes.
about your experience, how you found us, and
Yes.
how was your surgery and your experience after surgery?
Okay.
Up to it has been 6 days now, I suppose.
This is a 6th day.
Yeah. So
After
could you
my
just
surgery.
narrate in brief
Yes.
in about 2-3 minutes?
That's fine. I live in UK for past 56 years, and last year I went to research on a Google for bariatric mini bypass, and I found quite a few doctors, surgeons, and in the only thing which I was found out was that Dr. Radcliffe and Dr. Kular is the best surgeon in India. And there are surgeons in UK, but not as mini-gastric surgery bypass. It took me about a year to research this. So then I made my mind up to have it done in Punjab. in
But
Kular
how did
Hospital.
you make up your mind that mini gastric bypass is, better procedure than others? How did it sound to you? I mean, how could you get to know about this?
I first of all, I consulted with my local GP,
Uh-huh.
and he said that if you want the surgery done, there's only two places you can done.
Mm-hmm.
One in America,
Mm-hmm.
USA, and one in India.
Your
And
GP was Indian?
He is come from South India.
South India. Okay.
Dr. Kumar.
Okay. Right. So you must be having some knowledge about
Yes, that's
Indian
it.
scenario.
That's
right.
how
Okay.
I found out about
Good.
yourselves.
Okay.
Then I arrived here, got admitted into the hospital without any problems. I made the appointment from England,
Okay.
which was on the 28th of May.
Okay. You made the
2019.
appointment yourself on the website
on
or
the-
through email or by telephone?
Through the telephone.
Through telephone. Okay.
Yes.
Nice.
And I spoke to Ramanpreet.
Ramandeep. Yeah.
Ramandeep. I spoke to her
Okay.
and made the appointment. And so I was admitted on my first day at the operation. It went very smoothly. It's about 25 minutes operation. I woke up a little bit drowsy. Within 1 hour, I was sipping water. And every sort of hour, I kept on sipping water. In the afternoon, about 5 o'clock, 4:30, 5 o'clock, they managed me to get up and start walking.
Good.
And I walked quite a few times, and that was my first experience.
Okay.
And the second day, I had fluid. I was on fluid all day with milk. Then it was a tomato soup.
Mm-hmm.
Then lassi
Mm-hmm.
and curd.
Okay. So that was
So
your first day
That was my first
after
day.
surgery.
After the
Right.
surgery.
Mhm.
So then the following day, and there was no pain, no aches, no.
Okay.
So I had a good night's sleep.
But right after surgery, for a couple of hours, what was the intensity of pain? If we try to quantify it out of 10, it was like 1 or 5 or 7.
There was hardly any pain.
Uh-huh.
You got more pain getting a splinter in.
Oh, okay.
So that's the
That's
difference.
good.
If you get a little splinter in your finger, you feel more pain.
Yeah, let me tell you here, this is important because
Yes.
every patient is concerned about pain after
Pain,
surgery,
yes.
and especially in bariatric surgery, when we are
Yes.
going to change all the connections inside,
That's right,
going to
yes.
make your stomach small and then bypass the first part of the intestine.
Yes.
Basically, we are following Dr. Robert Rutledge's technique of anesthesia, not
I
only the
see.
surgery, but the
Uh-huh.
anesthesia as well.
That's-
And This is a special anesthesia that is TIVA, Total
Okay.
Intravenous Anesthesia.
I see.
So, how do you understand that, TIVA? TIVA would mean that we are not giving paralyzing agents. You know,
Okay, yes.
paralyzing agents, succinylcholine, vancomycin. There are many chemicals, drugs which are usually given during
Yes,
anesthesia,
anesthesia,
so
yes.
that the patient cannot move.
That's
Because if you move,
yes.
then we cannot do
No,
the surgery.
totally, no.
But now there is a latest kind of anesthesia
Yes.
which goes by the name of TIVA.
Okay.
It means total intravenous anesthesia. That means no gases
Yes.
and no paralyzing agents. The good thing about this anesthesia is that patient gets out of the bed quickly
Quickly, yes.
because we have not paralyzed you.
No.
So it was just like a deep sleep
Yes.
and you don't have any pain.
Pain, no.
But once we switch off the anesthesia after surgery,
Yes.
you come out quickly.
Quickly, yes.
That's what you experienced.
Yes.
And then another thing, when we are not paralyzing, then in majority of the patients, we don't even need to catheterize them.
Okay, that's
The urinary
yes.
catheter.
Yes.
So how was it in your case?
No, I didn't have.
You didn't have a urinary catheter?
No.
So this is very important. Whenever you go back to UK
Yes.
and you talk to your GP, you must tell him that
Yes,
this
I
is my
will do it.
experience in India.
Yes.
Because in all the major surgeries,
Yes.
urinary catheter is almost indispensable. We
Yes.
have to catheterize the patient because we need to monitor the output, and patients cannot pour out urine because of the paralyzing agents which we use
Yes.
during
that is
surgery,
correct,
because
yes.
your sphincter is also
Yeah.
knocked out for a couple of hours, and then generally we have to keep the catheter for at least 24 hours.
Yes.
And in obese patients, most of them are diabetic,
Yes.
and there is high incidence of infection.
Yes.
So we want to avoid the infections.
Infection.
And
Yes.
if somehow we can manage not to insert the catheter, it's a big thing.
No, no.
And this is possible with our technique of
Technique,
Mini-Gastric
yes.
Bypass, which we have been able to polish over a period of 13, 14 years.
Yes, yes.
Because we take less time for surgery.
Yes.
It's not that we are rushing
No.
to complete the procedure, but
No,
it's
it's-
like a harmonic dance.
Yeah.
And the good thing about taking less time
Yes.
for surgery is that you need less amount of anesthesia.
Yes, yes, that's
And
right.
if we give you little anesthesia, because we just need to knock you out for 20 minutes.
20 minutes, that's all it is.
So less anesthesia means early recovery
Yes.
from anesthesia.
Yes.
And no catheters,
No. that-
no tube in the nose,
No, that's
no
right.
tubes in the mouth.
No.
And and even your intestines
Yes.
are having the normal peristaltic movements.
Yes.
So that is how you were able to drink water,
Water.
1 hour after
After the
surgery, because the
surgery.
intestine is not paralyzed.
Paralyzed.
It's
No,
working. So that is how these patients are back to normal diet so fast.
Yes.
And that's how we have been able to decrease the incidence of infections.
Yes.
And you'll be proud to know this. We have publications in international journals
Okay.
that our infection rate here in this hospital is one of the minimum in the world.
No, I realize that. Yes.
Yeah.
Yes.